Hello and welcome. Today we're diving deep into a less common, but important topic in urology: Triamterene stones. We'll explore what they are, why they form, how they affect you, and what can be done about them. Let's get started! So what causes these stones? The main culprit is the medication Triamterene itself. Triamterene is a potassium-sparing diuretic, meaning it helps your body get rid of excess fluid and sodium while conserving potassium. It's often prescribed to treat high blood pressure or edema. The problem is that Triamterene and some of its metabolites are poorly soluble in urine, especially at higher concentrations. This makes them prone to crystallizing and forming stones in the urinary tract. Now, let's look at the pathophysiology. When Triamterene is ingested, it's metabolized by the liver. Some of these metabolites, like 2-hydroxytriamterene sulfate, are even less soluble than Triamterene itself. As these compounds are filtered by the kidneys and concentrated in the urine, they can precipitate out of solution. These microscopic crystals then bind together and gradually grow, layer by layer, forming larger stones. Factors like urine pH, urine volume, and the presence of other substances in the urine can also influence the rate of stone formation. Triamterene stones are relatively rare compared to other types of kidney stones, such as calcium oxalate stones. Precise epidemiological data is limited, but their incidence is directly related to the use of Triamterene-containing medications. People taking Triamterene for extended periods or at higher doses are at a greater risk. Also, individuals with underlying kidney problems or metabolic disorders may be more susceptible. The signs and symptoms of Triamterene stones are similar to those of other kidney stones. You might experience severe flank pain, which is pain in your side and back, often radiating down to your groin. This pain can come in waves as the stone moves through the urinary tract. Other symptoms include hematuria or blood in the urine, nausea, vomiting, painful urination, and frequent urination. If the stone blocks the flow of urine, it can lead to a urinary tract infection, which can cause fever and chills. Diagnosing Triamterene stones typically involves a combination of imaging and urine analysis. A urine sample can be tested to look for the presence of crystals, blood, and signs of infection. Imaging techniques like a CT scan, X-ray, or ultrasound can help visualize the stones in the kidneys, ureters, or bladder. The composition of the stone can be confirmed through stone analysis after it's been passed or removed. While there aren't specific types of Triamterene stones beyond the basic composition, the size and location of the stone will influence the treatment approach. Treatment for Triamterene stones depends on the size, location, and severity of symptoms. Small stones may pass on their own with increased fluid intake and pain medication. Alpha blockers, which relax the muscles in the ureter, can help facilitate stone passage. For larger stones, more invasive procedures may be necessary. These include extracorporeal shock wave lithotripsy, or ESVL, which uses shock waves to break the stone into smaller pieces. Ureteroscopy involves inserting a thin, flexible tube with a camera into the ureter to visualize and remove or fragment the stone. In rare cases, open surgery may be required to remove very large or complex stones. Prevention is key. If you're taking Triamterene, it's crucial to drink plenty of fluids throughout the day to dilute your urine and reduce the concentration of Triamterene. Your doctor may also adjust your dosage of Triamterene or consider alternative medications if you're prone to stone formation. Maintaining a healthy diet and addressing any underlying metabolic disorders can also help. The prognosis for Triamterene stones is generally good, especially with prompt diagnosis and treatment. However, recurrence is possible, especially if the underlying cause, such as continued Triamterene use, is not addressed. Recent research has focused on developing more effective and less invasive methods for stone removal and on identifying genetic or metabolic factors that may predispose individuals to Triamterene stone formation. Scientists are also exploring novel drug formulations that could reduce the risk of crystallization. Thanks for joining us on this exploration of Triamterene stones. Remember to consult with your healthcare provider for any concerns regarding your health.